Hello, thank you for joining me. Today we're going to unpack what I think is one of the most complex issues within couples therapy and a very ethical dilemma, which is how therapists can properly respond when abuse enters the therapy space. So, in this episode, we're going to examine why couples therapy can increase risk within the therapy session and outside of the therapy session. And we're going to discuss ethical challenges that the therapist will face when the abusive partner is the one seeking therapy, how therapists can avoid enabling harm further, and we're also going to distinguish a trauma response between intentional abuse, and we're going to discuss a little bit about how the therapist can maybe view and guide seeing the difference between those two. So, intimate partner violence, is extremely complex and it has really serious effects on well being, as we know through research. It's very difficult to spot and notice, and it's even harder to treat and combat because there's no singular treatment for intimate partner violence. A therapist survey conducted in 2014 asked many therapists how they feel about treating intimate partner violence, and many reported that they feel a lot of uncertainty and they feel very underprepared when dealing with violent couples. It's difficult to assess the violence. It's difficult to know whether to treat and continue. And and they worry a lot about causing more harm and escalation after the therapy and also while the therapy is continuing. Additionally, according to some studies, couples therapy is actually a possible treatment. However, many other studies strongly unadvise this as an option. A systematic literature review that was done in 2016 compared 6 studies using meta-analysis and found that in certain cases it actually is a feasible option. However, this is only for couples experiencing situational violence and they wish to stay together. And we're going to discuss a little bit more about the difference between situational violence and coercion. But anyway, this is, I think, a very interesting contradiction to previous research because it begs the question of how to properly and handle intimate violence and whether couples therapy is a good option or is not a good option. And it also puts a lot of pressure on the therapist because if you have to be the one to decide, this is situational and this is coercion, it puts a lot of pressure on, that singular therapist. And you have to know how to spot the danger and set limits, and most importantly not to inflict more harm on your patients. So as we discussed before, it's really important to distinguish between situational violence and coercive control. Situational violence is defined as an escalation of an argument when emotions get out of control and violence occurs. So you may imagine you get into a really big fight with your partner and you have this kind of intense emotional moment, and then maybe the day after you're both very feeling very guilty about it and feeling very shocked of yourselves and ashamed that it escalated to that stage. But this is different from coercion, which is also known as intimate terrorism, which I found an interesting use of words. And it's defined as the intentional exertion of power and control using a variety of tactics, such as manipulation. So rather than situational, it's very intentional and very much has a purpose behind it. However, I also personally think that repeated acts of situational violence could very well escalate into coercion, and again, it puts a lot of responsibility onto the therapist in order to kind of read the room and read the situation of the line between those two because it can get very blurred. So, in therapy, a big dilemma of a therapist is wanting to help and wanting to help without hurting. So, especially in couples therapy, there are two narratives that are being taken into account, and ensuring that as a couples therapist, you create a really safe and trusting environment for both partners can be really, really difficult, as abusive dynamics can distort communication within the couple. And it can really silence the victim and it can compromise the therapist's ability to behave effectively. So often it's really difficult to catch and understand certain nuances of the relationship. Of course, we cannot read clients' minds, and we can't understand what's going on behind closed doors. The information given to us is within the session, and we, to our best ability, have to kind of read beyond the therapy room, if that makes sense. But the bottom line is a therapist's number one priority is client safety above all. So this is above the expectations that the clients may have about the session. It's above what they think is in their best interest. You, as a therapist, have to decide what is the best interest in each case. And we have an ethical duty to prioritize the client's welfare through confidentiality and beneficence, among other things, according to the APA. Interestingly, according to a lot of beliefs about what therapy is, people assume that the therapist behaves as a kind of neutral wall, just kind of absorbing information and acting as a guiding tool for people to make well equipped decisions on their own. But the question within couples therapy is what happens when the neutrality becomes dangerous and it's actually enabling bad behavior of the client, especially in times when the abuse is unidentified and it's undisclosed to the therapist. There are many risks associated with intimacy violence discussed in couples therapy. So, a study in 2020 analyzed how perpetrators of violence, mainly men, often express ambivalent terms about violence. So things such as, I don't know, I just had to do it, and things like this. And they studied how the neutrality and the neutral language can be really, really harmful in these cases. And in my opinion, so I related this back to a few like therapeutic techniques or therapists or philosophers or psychologists that we learned about. So, for example, like Carl Rogers and the unintentional positive regard in therapy, which is kind of just, always acting as if your client has all the capabilities on their own and you're just guiding them. Or, for example, Sigmund Freud and his belief of like minimization of personal reactions and kind of acting as a blank slate. This can be really, really harmful when you're dealing with intimacy violence within couples therapy. So, in such cases, as described by one paper that I found from 2019, only individual and accountability oriented therapy have the chance of working. In terms of neutrality, in terms of I want everyone's best interest and you have it all figured out, maybe this isn't the best case to go when working with couples like this. But again, it is up to the therapist to decide what's the best route. So, in addition to harm of neutral language, there's also a huge risk of re traumatization and an increase of violence. So, for example, within the therapy session, a safe space is created and the victim might feel very comfortable and safe to express opinions and emotions and get into it. And then once the session is over and the couple is back home without the therapist, the abuser may retaliate for information that was made within the session. So this will completely harm the therapeutic process because the victim does not feel safe within therapy to even express their true emotions because they're scared they're going to get in trouble for it at home. So this really makes therapy ineffective in these cases. And additionally, therapeutic language can be really misused and weaponized by the perpetrator. This has also been studied. And as the perpetrator learns a few phrases, like therapy speak, as we call it, it may cause that person to avoid responsibility. So I found an interesting case, which is basically leaked text messages between very famous actor Jonah Hill. Now I can't remember what he was in. Super Bad, is that the one? I think. And basically, so his ex-girlfriend leaked text messages between them. And in these messages, he is demanding his ex-girlfriend to refrain from surfing with men and posting bikini pictures. And he's listing all of these demands. And he, in the end, poses it as, well, these are my boundaries. And I think we can see this small case as a clear example of how the therapeutic language can be really utilized as a tool of control and power over the romantic partner. Obviously, this is just a small glimpse into what their relationship looks like, and we don't know what happened. We don't have the full picture, but it kind of helps us to see an example of how the language can be manipulated. And then it leaves the victim in silence because if she speaks out, she's disrespecting his boundaries. When in reality, those boundaries were very controlling. So that's an important case that I think kind of highlights the issue of therapy speak and how it can be manipulated. Additionally, it's really important, as I said, to inform clients about accountability of their trauma. So basically, informing clients that trauma can explain your emotions or triggers, but it doesn't explain, or excuse your domination, your intimidation. So a trauma response stems from dysregulation and fear, which can translate to the abusive behavior, but it doesn't excuse the abusive behavior. So, in a clinical sense, understanding someone's trauma should not overshadow accountability, and holding clients accountable in recognizing and understanding their trauma before it becomes abusive is also an extremely heavy burden to carry for the therapist. And allowing space for the trauma to explain bad behavior needs to be avoided in therapy. If you are able to excuse behavior because of the past within the therapy space, it can be really troubling for the victim because they feel, again, in a sense of silence of, oh, well, this person's behavior is excused because they went through these difficult things, so I can't really speak out about it. But this is, a framework we can possibly start with when we're understanding the relationship of trauma and abuse and navigating it in therapy, but it is important to align it with accountability. All right, I know we discussed a lot of heavy things today. So, in conclusion, working with couples where abuse is present is obviously a very ethically challenging and difficult situation that a therapist can face. And it's very tempting to remain neutral or rely on techniques where, empathy and unconditional positive regard, as we've been kind of taught. But these techniques can really enable the abusive behavior and re traumatize the victims. So, distinguishing trauma responses from intentional abuse is really essential in understanding someone's brain and their past, but it should never minimize or excuse bad behavior. Ethical practice requires therapists to prioritize safety above all and remain vigilant and well informed about the power dynamics. And you have to carefully select interventions that protect the vulnerable partners and promote accountability. So, individual therapy, trauma informed, approaches, and structured interventions could provide the safest path forward when abuse is present. Ultimately, the goal is to provide a safe space for healing that empowers the victims, holds the abuser responsible, and prevents further harm, which is a great ethical demand that the therapist has. But I hope today's episode gave you a little bit of insight, and I hope you enjoyed. Thank you for joining me, and I'll see you next time.